Hello, my name is Anaya Webb, and this is my week 8 final return demonstration over the head to toe assessment. For this video, I do not have a patient, so I will just be explaining the steps that will be going on during this assessment, and I will be using this bear for part of my assessment to show placement of the stethoscope for lung sounds and for other parts of the assessment. To start off, I will start off with AIDED by introducing myself to the patient and letting the patient know that I will be their student nurse for the day and that I will be completing a head-to-toe assessment, and it should take no more than 10 to 15 minutes. I will thank the patient ahead of time for participating in being cooperative as I am completing this assessment. Of course, next I would perform hand hygiene. I will provide privacy by shutting the door or pulling the curtain. My patient would be in a gown with shirtless so that I'm able to assess certain parts of their body over bare skin. I would next identify two patient identifiers. I would identify the two patient identifiers by having my patient verify their name and their date of birth, and I would check that along with their wristband and make sure that I have the correct patient, and I will also check that along with the information in the computer. After that, I will go ahead and assess my patient's allergies and pain. So I will ask my patient if they have any known allergies, and I would have them rate their pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain. So I've asked my patient have they had any allergies. My patient has stated no, they don't have any allergies, and he states that his pain level is a 0. So next, I will go ahead and inspect my patient's general appearance. So as I'm looking at my patient, I'm going to assess for my patient's level of consciousness, and I'm going to check and make sure that my patient is alert and oriented ×4, which means that I would check for person, place, time, and situation. So I will ask my patient their name. My patient states his name is Mr. Bear. He states that the time is 9:39. and that he's in a doctor's office, and the situation is that he's being assessed, and he's completing an assessment. And so that would note that my patient is A&L ×4 because they were able to state person, place, time, and situation. Next, I would assess my patient's behavior. So I would look at my patient, and as I'm asking them questions, I would note their mood, their speech, and their facial expression. So as I'm looking at my patient, his mood is very calm, he's happy, his speech is clear as I'm asking questions, and he's able to answer them, and I'm able to fully comprehend them, and his facial expression is appropriate for the situation. Next, I will go on to assess my patient's skin and nails. So first off, I'll start by inspecting my patient's skin, and as I'm looking at my patient's skin, I'm looking for the color. I'm noting that my patient's skin tone, that my patient's skin color is even toned throughout, and it's appropriate to my patient's race. I'm looking for any lesions, any signs of wounds. I don't see any lesions or signs of wounds, so I would note that there are no lesions or no wounds